Thank you for joining me today. In this video, we are going to learn more about case studies, psychiatric case studies. I have different case studies. Some of them are psychosis, some of them are ADHD, some of them are Autism Spectrum, some of them are Delirium. So we want to go over different case studies in this video. Stay tuned. Thank you. So our first case study is "32 years old with emotional distress after losing their job. Mental status examination is otherwise normal. No psychosis or mania. And the diagnosis is adjustment disorder with anxiety and depression. Treatment options are supportive psychotherapy as a first line of treatment, cognitive behavior therapy for coping skills. We are going to also have them have SSRIs if the symptoms are persistent and worsens. So if they have a depression and anxiety, we're going to treat those symptoms. We are going to monitor the behavior, monitor the symptoms weekly for worsening depression, monitor sleep, appetite, and function. We're going to educate the patient about stress-related emotional reactions are common after major life changes. Symptoms will improve with coping support and time. Avoid alcohol or substance use for symptom relief. Then we are going to set up for follow-up plan. We are going to follow up with the patient after 2 weeks to 4 weeks. Initially, earlier follow-up, we can have earlier follow-up if the patient is having a suicidal ideation. Our second case study is an ADHD child who is 9 years old with persistent inattention, hyperactivity across the school and home. And the diagnosis is ADHD. Treatment options are methylphenidate or amphetamine. Baseline stimulants are the first line of treatment for ADHDs. If the stimulants are not tolerated, they can have SSRIs medication such as atomoxetine. We can have also behavioral parental training and school intervention, because 9 years old. He's 9 years old. We will monitor the blood pressure, heart rate, weight gain, appetite, sleep pattern, growth. trajectory in the child. We will educate the patient. We will educate the patient, parent, teachers about the medication improves attention and impulse control, but does not cure the condition. Structural routine improves the outcome. Consistent school and home behavioral strategy are essential. Then we will go ahead and set up follow-up appointment after 2 to 4 weeks during titration of the medication. Then every 3 months, 1 tablet. Our next case study is 5 years old child with poor eye contact, delayed speech, repetitive behavior, and the diagnosis is Autism Spectrum Disorder. The treatment options are applied behavior analysis therapy, speech therapy, occupational therapy, and then if the child is severely irritable, they can have Risperdal or Abilify. We will monitor the behavior severity scale. We are going to also monitor the weight, metabolic, if the child is using antipsychotic medication. Then we are going to have a patient education about early interventions improves the long-term outcomes. Structural environment reduces stress. Medication targets irritability, not core social deficit. We are going to set up the follow-up appointment every 1 to 3 months, depending on the severity. Then the next case study is 82 years old who hospitalized with acute confusion and fluctuation attention. And the diagnosis is delirium. The treatment options for delirium is treat underlying. First, we are going to treat the underlying medical causes. If they have a UTI, infection, dehydration, we are going to treat those first. And then we are going to prescribe low dose of antipsychotic for severe agitation if necessary. Avoid benzodiazepine unless they are drinking unless they are withdrawal for alcohol or sedation. If they have any alcohol, if this delirium caused by the alcohol or the sedative medication is, and they have any withdrawal, then we can have benzodiazepine. But if they are just a delirium for psychosis, we are not going to give them benzos. And then we are going to monitor the mental health status every shift, electrolytes, infection, oxygen. We are going to review the medication for anticholinergic burden. Those can cause the delirium, so we want to assist those and monitor those. We want to educate the patient about conditions is usually reversible. Family involvement improves the orientation, minimize sensory overload, and monitor sleep hygiene. We are going to follow up daily inpatient reassessment until it resolves. Our 50 case study is a 74 years old with progressive memory loss over 5 years. And the diagnosis is major neurological disorder due to Parkinson's disease. Treatment options include Donepezil, rivastigmate, memantine for moderate to severe stage, behavior management for agitation. We are going to monitor the cognitive function assessment over time, functional ability in a daily living tasks, weight and hydration status. Patient education include disease is progressive, not fully reversible. Safety planning is essential. Wandering and driving are one of the behavior and safety issue. Caregiver support is crucial. And we are going to set up a follow-up appointment every 3 months to 6 months. Our next case study is alcohol withdrawal. So we have a 45 years old with tremors, sweat, anxiety after stopping alcohol. Alcohol, and the diagnosis is the alcohol withdrawal syndrome. Treatment options include benzodiazepine for withdrawal management, thiamine supplement to prevent Wernicke encephalopathy. And then we are going to monitor the electrolytes. We are going to also monitor vital signs every 4 to 6 hours, withdrawal severity scale, seizure precautions. We're going to monitor those. Education, patient education include the withdrawal can be life-threatening. Long-term abstinence reduces recurrent risk. Support programs improve recovery. Close follow-up within 1 week after discharge from the hospital. Our 7th case study is a 22 years old with hallucination, delusion for 8 months and functional decline. And the diagnosis is schizophrenia. What is the treatment for schizophrenia? Treatment options include respiral, Cyproxa, Seroquel, clonazepam for treatment resistant illness. Long-term injection, antipsychotic medication for adhesiveness. And then we are going to monitor metabolic syndrome monitoring, like weight gain, lipids, glucose, blood glucose. We're going to monitor also ABDS. Those are the symptoms of a psychiatric medication. White blood cell count. For the clonazepine, it lowers the white blood cell, so we want to monitor that. We want to educate the patient about medication. Medication prevents the relapse. Early discontinuation increase the relapse risks. Avoid substances such as cannabis. Follow up 2 weeks to 4 weeks initially, then monthly once a tablet. We have 8 case study, and that is bipolar disorder 1, mania. We have a 28 years old with decreased need for sleep, grandiolous, risky behavior, require hospitalization, and the diagnosis is the manic episode in a bipolar disorder. First line of treatment is mood stabilizer. Lithium is the first line. Valproate for acute mania. A typical antipsychotic for acute stabilization. We want to monitor the lithium level, kidney function, thyroid function, liver function with the valproate. Metabolic monitoring with the psych medication. Patient education includes sleep regulation as essential for relapse prevention. Medication adhesiveness prevents recurrent. Avoid antidepressant medication. Monotherapy. Follow-up will be weekly during the acute phase, then every 1 to 3 months. The 9 case study is major depressive disorder. We have a 40 years old with depressive mood, sadness, fatigue for 2 weeks. And the treatment options include SSRIs, they are the first line. SNRIs or buprenorphine is the alternative. Electroconvulsion or ECT for severe or psychiatric cases. We want to monitor suicidal ideation at each visit. We want to monitor the sleep, we want to monitor the appetite changes, medication side effects. We are going to educate the patient about medication, taking the medication several weeks to work, because the antipsychiatric medication takes several weeks to work. Early side effects do not mean failure. Therapy improves the long-term outcomes. Follow-up follow-up plan will be 1 to 2 weeks after initial treatment, then every 4 weeks until they stabilize.